Joining us today is Michelle Kelly, Lecturer, Director, Simulation and Technologies, Faculty of Nursing, Midwifery and Health at the University of Technology, Sydney, who will be speaking at IIR's Clinical Training and Workforce Planning Summit 2010, taking place on the 31st of August to 1st of September in Melbourne. Hello Michelle, thanks for joining us.
Hi James.
First of all, can you start by explaining the theory behind authentic simulation learning experiences?
Well, the theory is to really get the students actively participating in a learning experience, so it makes lab classes come to life. And it's really educationally a socialist, constructivist approach where students are learning from others in the context of a specific patient care episode, and they're learning more than just skills to undertake patient care. They're really looking at the non-technical skills or the behavioural skills that we talk about, and that's teamwork, communication, management, leadership. So it's an all-encompassing learning experience.
And what are the benefits of simulated learning over real-life scenarios?
It's an opportunity for people to make errors, not harm the patient, but to stop and discuss and afterwards reflect on the learning that's happened. So all in all, it's the aim is to improve patient safety by people having practiced the skills on a patient in a fairly authentic environment, learn from their errors, repeat the correct procedure, and reflect on that in practice.
And how can higher education establishments integrate simulated learning experiences into their courses effectively?
Well, it's a challenge for Australian institutions because we have such large numbers in our nursing cohorts in particular. At our university we've got about 1,400 plus students. So it needs a very planned and strategic integration. But what is possible is that you can blend several theoretical concepts from different subjects, merge it into one patient care simulation scenario, which then plays out all of those technical and non-technical skills. So the learning all comes together like it does in caring for a patient in the real clinical setting. So integrating it is a slow and deliberate and planned process. It often is more successful if you have a leader leading the integration, modelling how to do things. It's really just an extension of current practice, but it's a bit of an unknown concept. But once people are familiar with it and see how just an extension it is of their current work that they're comfortable with, then they take it up and realise the powerful learning that happens in it.
And how do you see simulated learning developing in the future?
Well, there's a lot of talk in the US about replacing clinical hours within a program with simulation, and that's in response to the pressures of trying to get clinical placements. But I can, like occurs now, we can program a simulation scenario of key patient events like someone going to pulmonary edema, someone having chest pain, other scenarios which are low volume but high risk events that don't happen that often in clinical. So it's a random event if students get that experience firsthand in clinical. So programming those types of events into a program is pretty important so that the graduate is familiar with what to do, and the expectations of consumers and employers is such that they expect this person to be functioning as a registered nurse. So I think it's an unknown at the moment where it will go, but there's certainly a lot that defence and aviation are doing beyond a typical ward or intensive care type room, and they're looking at things like caving and 3D and immersive virtual experiences. So the sky's the limit, I guess. The budget's the limit.
You're speaking at IIR's Clinical Training and Workforce Planning Summit, taking place on the 31st of August to the 1st of September 2010 in Melbourne. What will be the focus of your presentation?
My presentation is really giving a case study example of how we use simulation for our undergrad and postgrad students in nursing, midwifery and health. The title I've put is Enabling Authentic Simulation Learning Experiences for Tomorrow's Practitioners. And in summary, it will be telling a story about our experiences within the last 5 years of planning and refurbishing, integrating and introducing simulation learning experiences across the board. So I'll be talking in a little bit detail about elements to help the successful integration and implementation of these learning strategies.
And finally, what do you hope that delegates will take away with them from the event?
I hope that people will become more familiar and understanding of what the range of simulation learning experiences can be, the powerful learning and the relationship to patient safety that evolves around simulation, and all in all that this is the way it's going, and technology is in part driving this as well. And it's also matching what the student expectations are, particularly the digital native generation who learn in a different way.
Michelle Kelly, many thanks for your time today.
Thanks, James.